Welcome to this new Gentian webinar about our new biomarker, retinol-binding protein. My name is Ella Trosten, and I'm the product manager of the Gentian RBP Immunoassay. Today, I want to give a short introduction into the biomarker RBP and highlight its different clinical utilities. This is the agenda for today's webinar. I will begin with a short introduction of the RBP protein itself, followed by a short introduction into the 4 different clinical applications for RBP. Vitamin A status, undernutrition, diabetes, and renal dysfunction, finishing with the retinol-binding protein immunoassay available from Gentian. I want to start with giving a short introduction into the retinol-binding protein, also known as RBP for short or RBP4. It is a member of the lipocalin family and a major carrier protein for hydrophobic retinol, which is the alcohol form of vitamin A. It is a small protein with a size of 21 kilodaltons, and as you can see in the structure on the right, where you have the retinol as the gray structure inside the beta barrel. RBP is expressed in APO form, and when bound to retinol, it is called holo-RBP. Holo-RBP is then stabilized by forming a non-covalent complex with prealbumin, also called transthyretin, which is a tetrameric protein of approximately 55 kilodaltons. This strengthens the retinol binding and prevents renal filtration. Here you see the 3 steps of the RBP life cycle. It is primarily synthesized in the liver, and about 80% of RBP is stored in the liver. It also has a robust expression in the adipose tissue, but circulating RBP is liver-derived. Before exiting the liver, RBP forms a non-covalent complex with prealbumin. And as I mentioned, this strengthens retinol binding and prevents renal filtration. In circulation, we find holo-RBP. It's only when it's bound to retinol and stabilized by prealbumin, it will be in circulation and transport vitamin A to the target tissue. The concentration of RBP in blood in healthy individuals remains semi-constant. So it ranges from 30 to 60 micrograms per ml. When it then releases retinol, it is back to the APO form, which is the unbound RBP protein. This is then very quickly filtrated by the kidney, and more than 99% of it is reabsorbed by the proximal renal tubule and reused. Let's look into the clinical applications of RBP. RBP is described in a lot of conditions, and we have decided to so far focus on 4 of them: vitamin A status, undernutrition, diabetes, and renal dysfunction. If you look to the right and in the middle, in healthy individuals, the RBP levels are under homeostatic control, so they are semi-constant. The RBP levels can also be elevated. For example, an increase in RBP levels can be a sign of diabetes or renal dysfunction. But we can also see decreases in RBP levels. It can be reduced due to vitamin A deficiency and in undernourished patients. Importantly, RBP is bound to vitamin A in a 1-to-1 complex. So 1 retinol binds to 1 RBP molecule. This is why there is a strong correlation between retinol and RBP levels in the blood. To the right, you can see a graph that shows this very nice linear correlation between serum retinol and RBP. Under vitamin A deficiency, there is not enough retinol in the liver to ensure the constant levels of RBP in the blood. This is why RBP is a good surrogate marker for retinol in circulation. The clinical applications of RBP. RBP is much easier to measure than retinol in the blood, as retinol is measured with chromatography. It is of course a more direct measurement, but it is also more cumbersome. Using RBP gives a much faster access to results. With the Gentian RBP immunoassay, you can assess the vitamin A status, but also follow the effect of vitamin A supplementation. Another field where RBP is described is in undernutrition. This is general undernutrition, such as protein undernutrition, and not only specifically vitamin A deficiency. This is because RBP has a lower molecular weight and therefore responds to protein and calorie restriction, and thereby reflects the individual protein nutritional status. There's an inverse relationship between RBP and the severity of undernutrition. The lower the RBP, the worse it is. RBP has a very short half-life, making it a sensitive marker which can go up and down very fast and can therefore be used to monitor the success of nutritional treatment. The clinical application of RBP in undernutrition is to assess undernutrition and to monitor protein turnover under nutritional therapy. If we then go to the other side, where we look at those pathologies where RBP is increased, there is quite a complex relationship between RBP and diabetes, which is also reflected in the number of references. In short, RBP is described to be involved in the pathologies of obesity and insulin resistance, and thereby diabetes. RBP is increased in metabolic syndrome, which is defined by high blood pressure, high blood sugar, excess of body fat around the waist independent of BMI, abnormal cholesterol, and high triglyceride levels. It is also shown in a number of papers to be correlated with diabetic markers such as insulin, HOMA-IR, glucose tolerance, and HbA1c. And also importantly, it correlates with GFR, which is increased in patients with micro and macroalbuminuria. In the graph to the right, you can see normal glucose tolerance, NGT, at around 30, so quite low. Then you have impaired glucose tolerance, IGT, and type 2 diabetes, where you have increased levels. The Gentian RBP assay can be used as a non-invasive, accessible method for assessing diabetes. It can be a risk marker for metabolic syndrome, insulin resistance, and type 2 diabetes. It can be a prognostic marker for development of insulin resistance and glucose uptake. For example, in pregnancy diabetes, in the early pregnancy, it can be used as a risk factor. It can also be a diagnostic and risk marker for complications in diabetic patients, like cardiovascular disease and nephropathy. RBP is filtrated by the glomerulus of the kidney and reabsorbed, and catabolized by the proximal tubules. So in those patients with reduced glomerular filtration rate, RBP will actually accumulate because it is not filtrated out of the blood. There is also a very high correlation between RBP and estimated GFR, and also other kidney markers like creatinine and cystatin C. And you will see increased values of RBP in patients that have chronic kidney disease and acute kidney failure. You can see this in the graph on the right, where you have cystatin C, which increases with the different phases of acute kidney failure, and at the same time you also see RBP increasing. RBP improves diagnostics in combination with other kidney markers. High RBP baseline levels can be used as a risk marker for cardiovascular events, and high discrimination of diabetic nephropathy from other diabetic patients. The Gentian Retinol-Binding Protein Immunoassay. The Gentian RBP assay is an automated clinical assay with ready-to-use reagents. It is an open channel assay, making it easy to integrate into lab flow and routine. It is easy to analyze and gives a fast time to results. With its diverse clinical area of use and correlation to disease activity and severity, it offers to extend the assay menu to clinicians. Thank you very much for your attention, and please reach out to us if you have any questions.